I am super excited to be speaking with you today. I really want to be able to elicit better how music therapy can benefit you specifically within this field, the medical setting. I think it's a bit of an underrated field for music therapy, and I think there's a lot of really untapped potential that we haven't looked at as a society, that music therapy can really actually help individuals psychologically and physiologically. So I would just like to tell you a little bit more about myself. I am a senior here at Utah State University. I'm close to the end of my college career here. I just have a few more semesters. I had a bit of an eclectic approach trying to find what I wanted to major in. I started in biological engineering, which really helped me to engage my passion for science and the medical field, actually. And in so doing, I recognized that I really wanted to keep those aspects of my life, but I also recognized that the arts part of me, the part of me that creates and wants to help people that way, was also a part of me that was very prominent. And I found the music therapy major at Utah State University, and it turned out to be the perfect intersection of both science and arts. It's been very vigorous, but it's also been extremely rewarding, and I'd love to talk to you a little bit more about that today as well. I'm very passionate about it. I'm also a songwriter on the side, and so it was a really cool experience to be able to use those skills and techniques within a clinical setting to actually physiologically and psychologically help individuals. And it's another thing I'll be talking about today. So my philosophy here, I'll just read this aloud, is I believe that music therapy can create a space for individuals to improve their life. Music can serve as an effective conduit through which one can express themselves and better understand others. It can foster connection and bring about actual physiological and psychological change. And I really want to focus in on that actual physiological and psychological change because I think it's really important within a medical setting. What is music therapy? That's a fantastic question, and you may or may not be surprised to know that a ton of people ask that. It's definitely an underrated field. It's a newer field, and so there definitely needs to be a lot of advocacy work. So let's touch on that. Here is the American Music Therapy Association's definition. It says that music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And if we were in person right now, I would be asking you, what are some of the things that stand out within this definition to you? I might point out here that the clinical and evidence-based section is very important. I think a lot of people, when they conceptualize music therapy, think, oh, drum circles and yeah, music somehow makes people feel good, but it's kind of just hippie jazz. No, music therapy is actually based on science and decades worth of research, which is fantastic because that means that we can prove that it really does help people, and we can find different ways in which it can continue to help people in the future. And I think that's fantastic. Another important part of this definition I really want to point out is that music therapy is accomplished within a therapeutic relationship with a credentialed professional. A lot of people, and we'll talk about this on the next slide, can think about music therapy perhaps as, listening to your favorite song and suddenly feeling better, quote unquote, or running and being able to run harder, faster, longer, better, with music. Little Daft Punk moment there for you. Which, those are fantastic elements of music, but the thing that really makes music therapy is that it is actually accomplished with a therapist who has undergone a lot of training and schooling to be able to understand what they're doing and how it affects the person. They work on specific individualized goals with them. It's not just, using music as a concept overall, just to feel better overall. It's very specific and intentional. Again, just to emphasize this last point, this is kind of reamping what a music therapist is and what a music therapist is not. So here on the left here, we see that we are board certified individuals. It means we have that MTBC credential, which is only achieved after completing an approved 4-year program, obtaining 1,200 clinical training hours beforehand, which is accomplished both through practicum and internship, and also completing all the coursework required, obviously within the 4-year degree program with pretty high marks. And we also have to pass what's called the CBMT, which is an exam which gives us that credential. and essentially it assesses our capability as a therapist and a musician and allows us to become professional music therapists. So again, on the right here are just some other very amazing professions which also can benefit individuals but are not considered music therapy because they're not completed by a board certified music therapist, and they do not meet their requirements here on the left, even though they're great. They're just not music therapy. We kind of talked about this before, but how does one become a music therapist? First of all, of course, you got to audition to get into an approved program, and this can be pretty rigorous. I know it was terrifying for myself. You are assessed on your musical capabilities, your personable capabilities, what's your emotional intelligence like, can you connect with people, that kind of a thing. Also, your academics or scholarship, those are all very important. And then obviously once you get into the program, you have to complete the coursework. And here are just some of the facets that we focus in on within our program specifically. Musical foundations. So this is accomplishing what a typical music major would do. We are required to have a major instrument, and we also have to go through a series of juries where people will assess our musical capabilities, and that is stress inducing. It's great, but it also very much has, obviously helps you to obtain classical musicianship, which is fantastic and useful in the field, but it is rigorous. We also have our clinical foundations, as well as specific foundations within the field of music therapy itself, our general ed credits, which are specific to whatever university we're going to, and then electives within music therapy. And specifically at Utah State University, it's a very science-heavy program here. So we have a lot of biology credits. We have to learn and take anatomy, behavioral health credits such as neuroscience. We really focus in on the science part of it. Again, here we go. Science. Music therapy is science-based. And it's very important to note that, and to note that it is founded on decades of research, which you can find within a lot of these accredited music therapy journals. These contain information which validate all of the interventions that we implement within our sessions here across all different kinds of populations. You can look back through studies all the way through the 50s up till now, even before then, I believe, and it's a growing field. It's a fast growing field, and there's new innovations and research that we're learning about every single day about how music actually can truly help people. So I would definitely recommend looking into these journals if you're curious to learn more about some peer-reviewed literature in music therapy. I have read through a lot of these journals. They're fascinating. Who can benefit from music therapy? Fantastic question. So here's just some of the general populations we work with. We work with a lot more as well, but here are just some categories: hospice and bereavement, developmental and learning disabilities, substance abuse and rehabilitation, mental and emotional health, and today we will specifically be focusing on the medical setting. So what does music therapy look like specifically within a medical setting, like a hospital or a rehabilitation center? Here are some of the places that we specifically focus in. The NICU is a prominent one. I think if you know anything about the process of helping a premature baby become healthy and being able to leave the hospital, it can be a very sensitive process. Those individuals are very prone to sickness and illness and all different kinds of ailments. It can be very risky, to have people come in and help them. But what they have proven is that music therapy actually helps to shorten the stay of a premature infant in a hospital. It has been proven to do that, and it has also proven to improve the parent-infant bond, which greatly can help infant success and health. Additionally, within the setting, they found that music can actually help to modulate the heartbeat, the breathing rates, and different kinds of physiological aspects of premature infants, which sometimes they struggle with. So that is very important. Over here, we have pain management. This is something that can go across all different areas in a hospital setting. It doesn't matter, necessarily what the specific population is. Music therapy can help with lots of different kinds of pain management techniques. I think this is really important actually, because within medical settings, pharmacological means can oftentimes be very expensive for people to have, and also sometimes addicting. And they have proven that music therapy has helped to reduce medication costs for a lot of different patients regarding pain management. So this is something I feel like is particularly important that can be used in a hospital or otherwise medical setting. Down here in the left corner, we have physical and neurological rehabilitation. There is a specific facet of music therapy called neurologic music therapy, which deals a lot with the brain and the neural pathways of the brain that affect movement, your speech, your motor pathways, and it basically tunes into music's capability, the brain's capability to understand music, and uses that to help people within rehabilitation circumstances within their life, such as people learning how to walk again, or people trying to have a steadier gait, such as people with Parkinson's. Music can actually help people improve those things, which I think is incredible. Over here we have the promoting of relaxation and reducing anxiety. This is another aspect that can go across all medical settings than a hospital or otherwise medical setting. And essentially, music can help people, music therapists can help people to modulate certain states of being from, something more negative to a more desired state. And if we come over here, we can see how do music therapists help their clients achieve these goals. We have specific interventions that we use, and here are just some of the ones that we can go over. Guided relaxation really touches on the reducing the anxiety that we just kind of talked about. The music therapist can actually attune to what an individual is feeling physically or psychologically in the moment, and they can reflect that within their music, and then through the musical process, modulate them to a desired state of being, which I think is incredible. And rhythmic auditory stimulation is also one that is really interesting. This is the one that we were talking about with Parkinson's, actually. Basically, there's a process called entrainment where the body is able to take an external rhythm and internalize it so that they are better able to replicate a desired rhythmic movement, such as a type of tempo in receiving one's gait or improving one's gait. And then there's musical speech stimulation, which is another NMT technique, neurological music therapy technique, which can actually help people who potentially have aphasia or recovering from a stroke, can actually help them to regain their speech, which is really cool. I'm biased, but I think it's really cool. And here is actually just a little video of rhythmic auditory stimulation happening for a Parkinson's patient. So I will let this play for you.
Smiley.
I'm almost done. Okay?
Yeah, almost here, but okay.
All right, so that is just an interesting representation of how music can physically help someone regain their skills in walking. And this is just one example of neurologic music therapy. As you can see, the person doesn't necessarily become dependent on the music. They're actually able to regain the skills and maintain skills even after the musical process. Okay, so why choose music therapy? It is very versatile. Having one music therapist within a hospital they can work with lots of different populations. They are a non-invasive alternative to traditional medical interventions. They help people reduce those costs. And a lot of times, people I think are scared of different kinds of therapies or medication, and music kind of offers a lot of times more agreeable pathway to help people accomplish the same kinds of goals. And again, it's a growing field, and it has a lot of potential to help all different kinds of populations. And of course, it's science-based, research-based, so it's all very valid. Here's a cute little quote from Bob Marley. And I'd open the space for questions at the moment, but as we are at the end of our presentation here, I will just thank you for watching, and I hope that you consider music therapy for your specific medical setting. And thank you so much for your time.